Hello everyone and welcome to this health education session. Today I will be explaining ectopic pregnancy, a serious condition that every woman and health worker should understand. Let's begin. So what is ectopic pregnancy? An ectopic pregnancy is when a fertilized egg implants outside the uterus, most often in the fallopian tube. This kind of pregnancy cannot develop normally and can lead to life-threatening conditions if not treated early. Why it matters globally? Because globally, ectopic pregnancy affects about 1 up to 2% of pregnancies. According to the American College of Obstetricians and Gynecologists, it is one of the leading causes of maternal death in the first trimester, especially when not diagnosed early. That's why it's important to raise awareness and act quickly. So what are the causes and risk factors of ectopic pregnancy? So what causes it? There are several risk factors. A previous ectopic pregnancy is one of them. Pelvic infections like pelvic inflammatory diseases, surgery on the fallopian tubes, smoking, fertility treatments, and use of intrauterine devices. These can increase the chance of abnormal implantation. What are the signs and symptoms of ectopic pregnancy? Now let's talk about symptoms. The common signs include pelvic or lower abdominal pain, especially on the one side, vaginal bleeding after a missed period, shoulder pain, which may indicate internal bleeding, and in severe cases, fainting or even shock, especially if the tube ruptures. How do we diagnose ectopic pregnancy? Diagnosis requires a few steps: a positive pregnancy test, transvaginal ultrasound to see if the pregnancy is inside the uterus, and sometimes blood tests like beta HCG levels if no embryo is seen in the uterus but the test is positive. Ectopic pregnancy must be suspected. When we come to the treatment options, the treatment depends on how early it is caught. If caught early, a medication called methotrexate might stop the growth of the ectopic tissue. If the tube has ruptured, emergency surgery may be needed to remove the pregnancy and control bleeding. Most often, laparoscopic surgery is used, which is less invasive. So, what are the complications of ectopic pregnancy without treatment? Complications can be severe: rupture of the fallopian tube, severe internal bleeding, long-term infertility, or even death in some cases. That's why awareness and quick medical action are so important. Now, how can we prevent it? Treat sexually transmitted infections early. Avoid smoking. Be cautious with fertility treatments and always seek medical help as soon as you suspect pregnancy, especially if there is pain or bleeding. Early prenatal care can save lives. Disclaimer: before we end, remember, this presentation is for education only. If you or someone you know has symptoms, please consult a licensed healthcare professional immediately. Thank you for watching. I hope this helps you understand ectopic pregnancy clearly and accurately. Feel free to share this video and subscribe for more professional health education. See you in the next session.